All right, guys, we are going to continue on with Chapter 8, talking about different emergency procedures, complications, and first aid techniques. So we're going to talk about sudden illnesses, the first being fainting, or also known as syncope. So this is when people faint, pass out, also known as syncope, as I said. So there are some usual symptoms that occur prior to fainting, like sweating, lightheadedness, nausea, seeing stars or a disruption of sight, a ringing in the ears. Oftentimes this is due to a loss of adequate blood flow to the brain. It can also be caused by emotional issues or causes hypoglycemia, pain, low blood pressure, dehydration, hyperventilation. So lots of different things that can cause fainting. The treatment, you want to help the patient to the ground if you can tell that they're about to faint to make sure that they don't get hurt in the process. You're going to raise their legs and feet a level of the heart, treat the underlying causes, provide comfort measures, and if it's due to a complex medical condition, you're then going to call EMS for transport to an emergency department to get checked out. One thing to mention with fainting is this often happens when patients get blood drawn. So if you're the MA and you're responsible for taking blood from patients, know that fainting can be pretty common. Another sudden illness may be a seizure. There are many different types of seizures, which you can see listed here under their symptoms, because depending on what type of seizure it is, they will have various different symptoms there. The cause most oftentimes is a patient has epilepsy, which is the chronic issue of seizures, but sometimes it can be like a febrile seizure, which means that the fever has persisted and is high enough to cause a seizure. And what a seizure is really an interruption in the normal functioning of the brain. So it's like a misfiring in our brain. So it's important to care for and understand the patient, treat them with compassion. Don't restrain them if they're convulsing. Allow them to move about. You're not going to try to hold them down, but make sure that they're safe. Move any dangerous objects away from them. If you have cushions, try to cushion the head. Try to keep things as safe as possible. Another sudden illness would be diabetes, or complications of diabetes, I guess I should say, which often include hyperglycemia, which means that the blood sugar is way too high. The symptoms here would be dry or flushed skin, a drowsiness, dry mouth. They may be breathing fast and have what's called air hunger, a rapid pulse. They may even have a dimmed vision. And here, they're going to need to decrease that blood sugar level. And then with hypoglycemia, this is when the blood sugar is too low. So you're going to need to elevate that blood sugar. And those symptoms, the patient may be pale, have moist skin. They may be a little like nervous or excited and have that excited behavior. They're going to be really hungry. They may have a full and pounding pulse and even double vision. So recognizing these symptoms, it's going to be important to check their blood sugar, especially if you know they're diabetic, and then follow your proper protocol. If it's a facility that can give insulin or give glucose, then you would do so. If not, you would activate EMS. Another illness may be a hemorrhage. This is when you're bleeding out, and here we're talking about an external bleed. So, of course, we're going to do everything that we can try to do to control the bleeding. We're going to try to apply direct pressure, treat the underlying cause. The provider, in this case, may be doing some suturing or pressure dressings, things like that. If it's due to epistaxis, which is a nosebleed, you're going to try elevating the head and pinching the nostrils, all kinds of things. It just really depends on where it's occurring and what's going on how you may treat that. While someone is hemorrhaging, you're going to watch their vital signs very quickly. If their blood pressure starts dropping, again, you would activate EMS and get them transferred out to an emergency department. So opposite of external bleeding, you may have internal bleeding. This is often caused by different traumas. And so different symptoms may occur, again, based on where this internal bleeding is coming from. Here, you're going to watch vital signs, try to prevent shock from occurring, and they're going to be needing to go with EMS to an emergency department. One that often may be called into a doctor's office but very quickly needs to be taken to an emergency room is patients that have symptoms of a CVA or a stroke. So these terms are interchangeable. A cerebral vascular accident is a stroke. A CVA is a stroke. And those symptoms are often numbness in the face or on one side of the body, loss of vision, a severe headache, confusion, slurred speech, nausea, vomiting, shortness of breath, difficulty swallowing, or paralysis. So if any patients come in with these kind of symptoms, they need to be rushed to an emergency room immediately, because with symptoms of a CVA or a stroke, if they're not treated within 3.5 hours, they are unable to get the treatment drug that we can give for strokes. So it's so important for these to be treated immediately. So you'll see this FAST here on the bottom. This is an acronym they came up with. If your face starts drooping, again, this can be a numbness on that side of the face as well. If your arms are weak or numb on one side of the body, if the speech is slurred, then there is a limited amount of time for this patient to be treated. And so we need to get them to an emergency room as soon as possible. Another one is a myocardial infarction, also known as a heart attack. Again, lots of different symptoms. When we think about heart attacks, obviously we're thinking about chest tightness, chest pain, but there are some other ones that often come with a heart attack. It can be jaw pain, it can be nausea. For our diabetics and our women, they often show these vague, odd symptoms. So we're going to make sure that we're watching their vital signs, hooking them up to the appropriate cardiac monitors, having the crash cart ready available, and if we have to at any point, obviously starting CPR. Which, speaking of CPR, I know most of you are required to get certified, and if you're not certified, I highly recommend getting certified, because most places do require it, and especially in healthcare, they will require you to be CPR certified. So CPR is short for cardiopulmonary resuscitation, and this is the combination of rescue breathing and chest compressions. So patients in cardiac arrest need CPR to help return the blood flow to their brain to keep them alive, to their heart, so the circulation continues. So we need high quality CPR. What this means is that we don't need to just stand around. We need to act quickly. Within 10 seconds, we need to start CPR. So don't take a lot of time assessing the patient. If you don't feel a pulse, start compressions. Start them immediately. It needs to be 100 to 120 compressions per minute with 2 inches of depth. That means that your hands are going down by 2 inches as you're pushing into their chest. With these compressions, you want to allow for chest recoil. And what that means is you want to allow that chest to come back up and to rise, to recoil. And then you're going to try and minimize as many interruptions to the compressions as possible. So don't, stop doing compressions to call 911. If someone is around, get them to call 911. Keep doing the compressions. So important. They even now, if you're not CPR certified, there are some campaigns, and you can see here in these YouTube videos, if you open those, that they are indicating hands-only CPR, which means just the compressions. If you can't do the breathing because you don't have the proper equipment, so you're not mouth to mouth, which is important, then just do the compressions on the chest. It's better than nothing at that point. But CPR cannot express just how important and critical it is to have those tools with you. So that sums up our Chapter 8 lecture. And if you guys have any questions, please let me know.